So I will be discussing the issue of obesity in pregnancy, as well as weight gain in pregnancy. We're quite aware that when a woman is pregnant, they tend to gain weight. So I want us to, look at all the factors that contribute to weight gain, as well as the complication of obesity in pregnancy. So when a woman is pregnant, they usually, on an average, they gain about 12.5 kg, but this varies from individual to an individual. So others can gain up to 25 kg. So what contribute to this weight gain? Remember, when the woman is pregnant, you have a baby inside the womb, so that baby is growing. So as the baby grows, that will contribute to weight gain of that particular woman. The womb as well, it's growing big, the muscles are becoming thick. That will also lead to increase weight. And remember, you've got this fluid, what we refer to as amniotic fluid, inside the womb. As the baby grows, that fluid as well is increasing, so that can lead to weight gain as well. And the other issue is fat deposits. When someone is pregnant, they tend to have a big breast. You see the fat being deposited on the abdomen and other part of the body, and that is simply because of hormonal changes in the body, as well as the issue of appetite. Because once you fall pregnant, your appetite changes as well. But that is very, very important when you have increase body weight as a result of fat. Because remember, when you get to 28 weeks and above, you need that fat, to be converted into energy, because that's where you really need more energy, as the baby now it's big and all that. And also in terms of preparation for breastfeeding, so the fat also helps. And then the other factor that contribute to weight gain is the issue of swollen legs. In most cases, you find that your legs are swollen and all that, so that can also contribute to weight gain. So let's talk about obesity. These are the individuals with increased body mass index even before they fall pregnant. And then this is the most dangerous one, because remember, it can actually predispose you to medical conditions such as diabetes, hypertension. You can even deliver your baby prematurely, and it also puts you at risk of developing urinary tract infections, where you tend to have this burning sensation whenever you pass urine and all that, and that can actually end up affecting your pregnancy. And these kind of patients, they also tend to to bleed before they deliver. So once they fall into labor, what happens if this particular pregnant woman is obese? They tend to have prolonged labor, which means they are at risk of being delivered by an operation. And also, an operation for them is not an easy thing, because remember, the abdomen is big and all these things. You're cutting through the fat and all that, so it comes with a lot of complications for this group of patients. And after delivery, they tend to have bleeding. They may still develop hypertension or high blood. They may also have this blood clot, because remember, after delivery, they cannot easily mobilize and all these things, so they are prone to having this blood clot, which can easily dislodge from wherever it started into the lungs, and it can end up losing life as a result of that. So in terms of the baby, if a woman is obese, they tend to give birth to big babies, maybe around 4 kg or so. And also the baby may have, you may get what we call shoulder dystocia, where the head of the baby comes out, but the body of the baby fails to come out, because of the size of the body. So that's what we refer to as shoulder dystocia. So I decided to choose this particular topic so that people can understand the significance of losing weight before they fall pregnant, because you are making it easy for the healthcare professional as well as yourself, when it comes to the issue of pregnancy. So if you lose weight before you fall pregnant, you're trying to avoid all sort of problems that are related to delivery. Thank you.